The latest guidelines issued Thursday by the United States Centers for Disease Control and Prevention, CDC, on its COVID-19 protocols came as a pleasant surprise to many Americans. Here in St. Lucia, medical professionals have also been reacting to the announcement. The president of the St. Lucia Medical and Dental Association, Dr. Merle Clark, says as enviable as this development is, St. Lucia is some way off making such an announcement.
Can this be replicated here necessarily? The answer to that, we believe as an association, is no. We are not exactly in the same place as the US is. In terms of vaccination, the number of vaccinated individuals or the percentage of the population which is vaccinated is significantly higher than here, for one. What we do know about vaccines is that we certainly reduce the risk of contracting COVID-19. And if somebody were to contract COVID-19, that it certainly reduces the risk of serious illness, hospitalization, and death. And that is important and that is significant. What is unknown is a risk of transmitting COVID-19 if you were to have it being a fully vaccinated individual. And we'd like to say here, importantly, that fully vaccinated means 2 weeks after you've gotten the second dose of the vaccine, or the two shot schemes. Johnson & Johnson really is the only one thus far, which is just one shot.
The director of the CDC, Dr. Rochelle Walensky, said, quote, "If you are fully vaccinated, you can start doing things that you had stopped doing because of the pandemic," unquote. U.S. President Joe Biden welcomed the development, stating, quote, "We have all longed for the moment when we can go back to some sense of normalcy," unquote. In St. Lucia, former Chief Medical Officer Dr. Stephen King says there are lessons to be learned from the latest CDC position on the protocols.
In this whole COVID-19 management, we're talking about really risk assessment and risk management. And you got to look, each person and each country has to look at their own risks and design their strategies to maximize safety of individuals and the population. Now, the CDC is basing, the science is showing us that vaccinated people have a reduced chance of transmission. So there's a reduced likelihood of transmission from vaccinated people. And further, vaccinated people are protected from getting severe disease. So those are two hard scientific facts that they're using to guide their policy recommendations. Also in the United States, you appreciate that 60% of American adults have already received their first dose, and 35.8% or so are fully vaccinated. So America is way ahead in terms of vaccination as compared to the Caribbean and, of course, St. Lucia.
The relaxation of some of the COVID-19 protocols by the United States Centers for Disease Control and Prevention is, in some sense, a reward to the American society for trusting science. Though the United States has not attained herd immunity, the high and growing percentage of fully vaccinated people mean that the health authorities are confident that measures like mask wearing outdoors for those inoculated is no longer seen as necessary. Stanley Lucian for the HTS News Force.